Okay. On how to implement a digital mental health pathway as part of an integrated care system. Today's webinar is hosted by the National Health Executive in partnership with Amwell. Our discussion will be full of opportunities, not just for our panelists to express their thoughts and opinions, but for you, our audience, to get involved by asking questions using the icon on the right-hand side of your screen. So please do add your voice to our conversation. If you want to ask a question of a specific panelist, then please put their name on there too. So to set the scene, mental health services were already stretched before the pandemic, but now the crisis in care has intensified. The pressures on mental health services and the people who deliver them are unprecedented and unsustainable. Whilst demand for treatment increases, mental health services are struggling to recruit and retain qualified staff. The inevitable outcome of this imbalance between supply and demand is longer waiting times for patients. In some cases, even high-risk patients are waiting not just months, but years to receive treatment. And it's not only about money. Funds are badly needed to address the challenges facing mental health services, but change won't happen overnight. It would be unrealistic to assume that there'll be a meaningful reduction in waiting lists in the short term. Well established as a standalone intervention within the NHS via the Improving Access to Psychological Therapies programme, digital mental health solutions are already being used to address capacity issues. The use of internet-based cognitive behavioural therapy programs allows services to treat more patients without any loss of efficacy for mild to moderate depression and anxiety. Digital therapeutics are now beginning to be deployed at other points on patient pathways, a change accelerated by the pandemic. These innovative models give services the opportunity to improve patient experience before, during, and after treatment. For example, by giving a patient help to manage their symptoms whilst they're waiting for their initial assessment. So, what challenges is the NHS facing in terms of providing crucial mental health services pre and post-pandemic? With the scene now set, let's welcome our panellists. They are Dr. Faris Al-Ramadani, Clinical Director at Warwickshire East Primary Care Network and a GP partner. We have with us Judith Chapman, a clinical services consultant and former clinical director with Berkshire Healthcare NHS Foundation Trust, and Douglas Hiscock, senior product manager at Amwell with responsibility for the SilverCloud platform. Thank you so much for giving us your time today, particularly given how stretched the NHS is at the moment. And I've put my glasses on now. It's always a good sign that I can see that you're all actually there now. Doug, let's start off with you, if we may. You have worked extensively in the mental health space, including for Rethink Mental Illness. And I mentioned in the introduction there that mental health services were already stretched pre-pandemic, and now post-pandemic, those challenges are probably greater. What are the main challenges do you think mental health services are now facing?
Well, from my experience, is the lack of staff, lack of investment in more staff to be able to help people. And so services are beginning to be stretched beyond any recognition from what they were maybe 10 years ago when I started. So it's a very challenging environment for services to run, and they need as much help as we can give them.
And in broad terms, just to begin with, before we take a much deeper dive, how can digital solutions help?
So the idea around digital solutions to try and automate some of the things that people do every day in their clinical practice. So for instance, with our program, you're able to put someone on the program and they can work through it at their own time and pace. And that allows you to manage your caseload much more efficiently. And also with the trust of the program being a nice guidance intervention, then you know that you're giving the right care to the right people at the right time. So it's very helpful for you to be able to manage far more numbers through your service.
Faris, let's bring you into the conversation if we can. Doug just touched there on lack of staff. Is that one of the big issues that you see?
Possibly and probably. From my perspective as a GP, it's there is growing demand for mental health services and intervention. We've seen that through COVID and after, and it's for us, it's that problem of getting people into a service. It's that delay from referral to actually being seen by IAPT and an intervention following suit. So our problem is we're seeing longer waiting times, and I imagine that's based on two factors: one being increased demand within IAPT and the psychological therapy services, and also a staffing issue, I'm sure, but I'm probably not best placed to comment on that specifically, but I'm sure that is a factor.
Judith, from your point of view as well, I mean, it's certainly correct, isn't it? A lot more people are relying on mental health services now, particularly post-pandemic. What are the main issues that you're seeing from your perspective?
I think from the experience of running services, I think it's being able to respond to the demand quickly, which is very difficult, particularly where there are staff shortages. And when there's a new sort of project that comes along, like community transformation, what we see is staff move from one area of mental health to another. And so there just isn't that sort of mass of staff able to fill the gaps. So this makes the digital solution even more fitting because of the demand caused by the pandemic. It was already there beforehand, but there's no greater time that we need all the help that we can get to support people.
Judith, does it make you sad as well to see the lack of staff? I mean, it's difficult now to recruit enough staff, to retain them. It's always been such a people service, hasn't it? And I know obviously there's a massive place for digital, but is that difficult with all your experience to see people disappearing from the service?
I think it is sad, and it just shows you the stress and strain as there's not enough staff that causes the people who are actually in post. The remote working has helped to some extent because people can get perhaps a better work-life balance. And people and obviously employers do need to be flexible to help support that. But yes, I mean, it is sad. And a lot of that, I think, is that there is stress with people having heavy caseloads, which again would help. Digital solutions can help to support more people without perhaps too much pressure on staff.
It's ironic, isn't it, Doug, that, they're trying to help people with mental health needs. And actually, as Judith rightly points out there, the staff are under enormous pressure. Explain to us how the SilverCloud platform can help and how that can relieve some of the pressure on the people that are trying to run these services to the best of their abilities in what are very difficult times.
So one of the hardest parts of running a service is knowing the right care to be delivered at the right time for people who are being referred in. So you can wait a considerable amount of time and have a very low level issue to be supported with. So our program allows people to work outside of the traditional boundaries of sessions every week at a certain time, and you have to attend them. And with the more complex lives that people live, that can be quite a struggle. So the program is able to be used what we call asynchronously. So the patient goes onto the program, works through it at their own pace, and then the clinician will support them when and if they need support through it. So if they're able to work things out for themselves, support themselves and do very well, then they will go through and recover quite quickly. This allows the service to create more capacity to see more complex patients, and they'll then be able to triage people into the right care at the right time as quickly as possible.
What kind of tools are on there, Doug? Can you give me some examples? I hate the word tools actually, but you know what I mean. What can people access?
So one of the best ways to start along your mental health journey is through what's called a mood monitor. So this is a kind of a diary that sits there and asks you at certain times how you're feeling and what's going on, and then allows you to make those connections between the thoughts, the feelings, and the behaviors that you're doing. So those are the kind of tools that are in there that help structure people's thinking and allow them to sort of experience new ways of dealing with the issues that they're coming across. Other things like there's things like the worry tree, which is a classic example. I think we all suffer from a lot of worry. And so being able to distinguish between what's a real worry and what's something that is more of a hypothetical worry allows you to make that kind of choice and allows the therapist to see very quickly what they need help with more rapidly.
Faris, just talk to us about what role digital solutions play for you in the enhancement of the provision of your services to your patients.
I suppose to answer that more fully, I suppose it was identifying what our limits are already, and I think our limitations were increasing demand, longer waiting times. We were aware that some patient cohorts didn't engage with IAP, didn't go forward with referring themselves into IAP services. So we became aware that there were already some barriers to treatment, because we know psychological therapies work, we know they're critically important, and the demand is only going to go up for psychological therapies, I suspect. So we were looking for a solution that would tackle some of those issues, and some of those barriers are a demographic. So we found that younger people are less likely to access IAPT. Geographical, so some people feel that they're further away from IAPT and less likely to be able to travel for sort of more face-to-face interventions. And it's also the waiting time. So waiting times, at the point of sort of the need for treatment, your motivation varies. So you want to strike while the iron's hot, so to speak. So longer waiting times are an impediment. So we wanted to find something that meant our patients could access treatment sooner in a way that was more suitable to them. And I suppose in one way it's getting access to treatment sooner, but it's also creating more options, increasing that menu of options, so people are able to find the thing that works best for them. And coming out of COVID, we had this sort of period of increased digital awareness, if that makes sense. Most people were using an NHS app to book their appointments or order their medication, so people were already engaging more with digital, so it seemed like a perfect opportunity to try and deliver something more. So the digital solution we looked at was based on the idea that we could get more people access to treatment sooner, empowering them to access that treatment sooner, overcoming barriers of geography, overcoming barriers of age, and so it felt like a natural fit. So it was just about providing that extra option to our patients, essentially also in the hope that if we can intervene sooner, then we can hopefully prevent progression to more serious and more high acuity illness.
And presumably, Faris, it gives you more time, because I know how overloaded the particularly GP surgeries are with people needing and trying to get appointments. Presumably, if some people are embracing those digital options, that buys you a bit more time to see those who need to come to the surgery and need to see you face to face.
Yeah, I think so to some degree, because those interventions are already rolling. And if they're on a waiting list of 6 months, then they're not going to get that much better. So yeah, certainly it will, at least theoretically, reduce that demand. Whether that's shown through or not is difficult to fully ascertain. But if anything, it's that sense of, we do this job because we want to deliver the best for our patients. Our aim is to make our patients better. And whatever tools we can access that will enable us to get our patients better, we'll happily work with. So for us, it's almost that feeling that actually is something I can offer you now. It's quite hard to you know, at the moment we've got increasing waiting times in secondary care. It's really hard to tell a patient, we'll refer you, but you're going to be waiting X number of months or years. You don't feel like you're giving your best. But if you can provide an intervention more quickly, more readily, you feel like you're giving something better to the patient, and that's in our interest, that's in the patient's interest. That's hopefully, at least again theoretically, that you increase patient and improve patient outcomes. And if you do that, then if you really look down the line at general practice and the demands within general practice, we are more likely to see less demand when our patients are at least mentally in a better place. So we know that poor mental health is related to poorer chronic disease outcomes, higher presentations of anxiety, depression. So actually, improving people's mental health and well-being will also have this follow-on effect, hopefully, to reducing pressure.
I think it has a massive knock-on effect. Judith, share, if you would, some of your story on what prompted you to really explore the digital interventions, and also when you were at Berkshire as well.
Well, when I was at Berkshire, we were one of the early adopters of digital solutions. And that predominantly was because then we were faced with a lot of young staff turning over, lots of maternity leaves, because we'd recruited a lot of our psychological wellbeing practitioners were all starting their families. And there was just a pressure on recruitment. Plus, there was this curve and expectation from NHS England to treat more people. So in a way, very similar to what we face now, a need to treat more people and staff shortages. We looked at what was available out there and realized that actually at that point in time, we wanted to work with SilverCloud and make sure that we could extend our digital offering in Berkshire. And we looked at the steps that we needed to put in place to become successful. And I think it was then about a culture change. It was about not thinking that this was second rate. It was about this solution was actually very good. It might not be what everyone wanted, but actually if we could help a lot of people early before they deteriorated, it was a very good solution. So we looked at how we could implement it, how we could introduce it, how we could introduce it to the right patients, on the understanding that perhaps people with more severe needs might want a face-to-face intervention. But if actually we could help everybody on a mild to moderate level, then our clinicians could help the people with more severe needs. And we ended up introducing it to 50% of our patient base, which it was well into several thousands. And the feedback from the patients encouraged us to just continue. And I was overwhelmed by the positiveness that came back, and obviously supporting our patients as well. So it was just an incredible journey of patients informing us that actually it really worked for them. And like Faris said, the reach for people, youngsters, unemployed, men particularly, actually doing something at their own time, and this concept that they actually had their therapist in their pocket, some of the feedback would come back like that. And one of our patients said, it's like a paracetamol. Everybody should have it. You should be able to dip into it when you need it. And certainly the relapse remission sort of problem with a lot of depression presentations is actually people need support when they need it. And that's what the digital platform provides.
I love that phrase, Judith, your therapist in the pocket. And interesting you highlighted men there, because I think it's fair to say in Faris and Doug's company that men are often less likely to come and talk about their medical issues than perhaps women are. And the fact that if you've got mental health issues, sometimes I think people feel embarrassed. I think there's still a big stigma. I think it's getting less, isn't it? The stigma now, because we talk about it much more openly. But perhaps that's also the benefit, Judith, of digital, that sometimes you can just do it in your own time, quietly, when you need it, rather than having to wait for an appointment or actually see somebody face to face.
Yes.
Yeah. Did you go on?
Sorry,
Doug.
just to say, yeah, one of the other things that we always think, that I think that being a man and having experience getting advice from friends, knowing that the app is endorsed by NICE and is used by the NHS is really important, because people get their information from some funny old places sometimes. So making sure that the phone has got access to the program and it's an NHS service is really important.
Yeah, it is really important. And also, Doug, I was just thinking, looking at some notes I received before we did this. Berkshire Healthcare was rated outstanding by the Care Quality Commission, and it was noted they continue to build on innovation as a global exemplar. I mean, that's the glowing reference to everything they did, but also shines some light on your contribution at SilverCloud, I would have thought.
Well, yes, I would say it's mainly the staff who are really engaged with this. It's always tricky because the staff there are amazing. They're always willing to come forward with ideas. We're at the moment doing a whole load of new innovations as well, which will come out towards the end of the year, which they're always got a great idea. And yet, really, with anything that you develop digitally, I'd say you have to work with a service, and working with a service like Berkshire has been a real treat for us.
Yeah,
I think I would just say, sorry, as well as the culture, I think one of the things we really noted, and I'm sure Doug and obviously Faris from his view as a GP, it is about leadership. It's about actually having a vision and looking at how you can bring the staff along with you and how you can maintain that vision. And it does take a lot of time. And so it's about that persistence very often to have an idea and stick with it. And I would recommend that, it's not an easy path, but it's a very rewarding one.
Oh, I can imagine. Do you want to add to that, Faris, about leadership and vision?
Yeah, I think so, and I think from my perspective, at least, it's always about the focus on the patient. So always keeping that line of sight that what we do is to serve our patient, make sure that we're giving them the best. And I think obviously digital solutions help solve many of the challenges that we face, whether that's recruitment or access. But actually, what we really want to look at is how do we raise the bar? How do we actually improve what we're doing? And actually, I feel like this doesn't just plug those gaps or help solve some of the deficiencies. Actually, this can be a way of moving us to the next level, improving that level of care that we provide. And I think nowadays there is this shift within the NHS to personalised care, so making care more tailored to the individual, not just you will go and do this, but actually we've got these options and choose what's right for you. So I think enabling our patients to have a greater access to different treatments and different modalities a way, I think, to go forward in the future. The other focus within the NHS as well is promoting self-help. We need to be empowering people to access tools much sooner, make them more readily available. We're not always necessarily the best at that, because actually, you know, if I had mental health problems, or actually I just wanted to improve my well-being, probably wouldn't know where to go other than to see their GP. And actually, we probably want to move away from that model. So actually having something, and what we've tried to do is make the online service really readily available to anybody without even needing to see a GP, so that people can start to access tools and actually empower themselves to access care, even before needing to see a healthcare professional. So I think I'm looking at it from both sides, resolving some of the problems and issues we have, but actually using this as a way to raise the bar and improve access to therapy.
And of course, it's not, is it, Faris, a one size fits all? This won't be for everybody. It's great to have this as part of your offering so that patients who feel it's for them can embrace it. And I also think it has a validation. If these self-help tools come via the GP surgery, I think that adds to the confidence that your patients will have in it.
I think that's probably true. And I think where GP is uniquely placed is its access to its population. We are the first line, you know, we're often the first people are coming to. So we'll often be the first presentation. We'll often see things that may not, you know, cross a threshold of mental illness, but actually just not very good mental well-being. So we're probably seeing that whole scope. And I think it probably comes to light when you're seeing that wide array of things, actually the limitations in what we've got to offer. So like I said, adding anything into the armory that we can offer can sort of only be a good thing. And I'm sure Doug will probably agree that there is no out-of-the-box solution that cures all, but actually it's about starting somewhere and actually embracing a technology, but being able to evolve that technology and look actually how do we then evolve this solution. And there's a lot of things to do, but I think innovation's a crucial part of improving patient care at the moment.
Doug, you're nodding away there.
Yeah, it's really important to work with the patients and with the clinicians all the time. Like it's simple little things about changing the way a module's pronounced, so it sounds more like an adjective, so people are doing things rather than being done to. And so there's loads of little clever ways that we've got really good at of understanding how do we get patients involved in things without it feeling overpowering, and more about them doing it for themselves and encouraging themselves to try the programs. And with Faris, he's really challenged us to think about how it works in the primary care setting, as you can imagine, and how we can make a program feel much more about an individual rather than it being one shop fits all kind of approach.
And Doug, do you get out there and talk to potential patients about what they need and what they would like to see and what they'd like to have access to when you're developing these new tools?
Yeah, that's the fun part of it. So we just developed a CAMS program, a children and young persons program, and I spent a whole day in a CAMS service just interviewing the staff. And then we worked with a group called Tough Times, who are a group of young people who'd gone through the system, and they just tore the program to bits, which is like, it's really fantastic. Like the thing to remember, we want people to play with it it to tell us what they think would improve, because we can only make it better by their experience. So yeah, we'll sit in services. I went to see a primary care network the other week with a whole load of clinicians, and they were really glowing about it all, and all had little suggestions that we can change and make it a lot better. So yeah, that's the fun part of doing
I was going to say that must be really enjoyable. I've got visions of you, Doug, with a little notebook and taking people
yeah.
on board. But I suppose because your services are digital, Doug, they can just be ever evolving. You can presumably make tweaks very easily through various feedback you collect along the way.
Yeah, we have to be really careful to make sure that we don't damage the underlying structure of the program, so that they're not NICE compliant, and they, like, you can accidentally suddenly be in a whole different area. So we have to be careful about making sure. We have a huge research team who do research on the programs the whole time, just to make sure they're working. And we do a lot of service user feedback as well. So yeah, it's very innovative. It's very exciting. So yeah,
I'm sure it is. Judith, what about challenges that you faced? I mean, every time anybody introduces anything new, there's always some challenges or some obstacles or something to get over. What would you say were your challenges in identifying potential solutions?
I think there was resistance. Some of it was because it was new, and that's like anything when you're trying to do it. And actually using the research and the clinical evidence, particularly to help win over the clinical minds and ears, so that actually people could read up about it and try it out for themselves. So there is a demo site that we could actually share with staff so that they could see what it meant. And also we gathered user feedback, and the user feedback helped to inform clinical practice, which I think, you know, was excellent. And things like training the staff, because there was a sense from, say, some traditional therapy that it wasn't personalized, it wasn't individualized, and that, you know, we were trying to treat the masses. And that really was where the staff training came in, so that if they were a supporter, they could actually focus on the messages that that individual left, so that you actually really tailored your feedback and perhaps your next step to perhaps unlock a program that might be around a sleep difficulty. If they said, you know, they were having difficulty sleeping, you could say, oh, well, perhaps actually you might like to look at these materials. Or there might be something around money worries that you could say, so that actually you very much listened. And that part of that actual interface and that relationship could still be there when you were supporting someone, by just knowing that they'd actually left you the information on the platform. If you quickly read it and responded individually, you could actually tailor the program. So I think that would be how you would sort of challenge it, is to actually help them to understand what you were trying to achieve and listen and be prepared to change. I think listen to patients, listen to staff, and try and work together to find solutions.
And Judith, when you overcame some of the perhaps initial resistance, particularly from the clinicians, have they embraced it and realized that actually it is a massive support now that they see how it's working and see that it can be more personal than perhaps they thought when there was the original talk of implementing this?
Yes, and I think it comes back to obviously training and developing champions, so that actually you've got people who support each other. So clinicians who can help their colleagues, because sometimes there's technical issues and they just need to feel more confident with it. But of course, the pandemic has changed a lot of the way that we respond to digital. So that has really helped. But the whole idea that you could run a stepped care service, so that perhaps from a step one, people might not be familiar with that, but self-care, self-management, and then actually if they came into a clinical area, so it can be used for different groups of patients. And I think staff can see that benefit, but also it's exciting. There is development now for people with more complex mental health needs on the SilverCloud platform. So that has been a gap, but the fact that that is now being addressed is going to help, I think, clinicians to feel they could help everybody at whatever level they present.
We'll talk to Doug about that in a minute, but Judith, just a quick question while you're talking about staff from the audience. Kylie says, which staff are trained to use this? Or which staff in your experience were
Yes.
trained?
Well, if you were in an IAP service, it would be psychological wellbeing practitioners, but there are other services where they haven't got necessarily that remit, and they might have psychological wellbeing practitioners. They might have mental health qualified staff. They might have other clinicians, psychologists and counsellors, and also sometimes they have wellbeing coaches if they're delivering some aspects that are more around self-care and wellbeing. Doug might
Kylie says she's in PCN.
Yeah, so
Okay.
we provide an awful lot of training at the beginning and right the way through the process, because obviously it's in our interest to make sure that the staff can use the program. So we go and we implement the program. We work with the staff to make sure they're comfortable with it, and then we'll have other training that goes on throughout the time of the contract. And every situation is different. So it's surprising how you can have a national delivery of a model and every place you go is completely different. So we work quite hard at making sure it fits into the way a service would provide their care. So there's an awful lot of work that we do to make sure that it doesn't completely disrupt a service. And the other bit that we're really careful to try and do is integrate with the case management systems. Like, everyone has to have the case management system. So we work really hard at making sure that it doesn't add a burden of extra admin for the staff. So there are times when we can't do that because we're going into new areas, but we are developing relationships with a lot of the management systems. So it could be a lot easier for people.
Cool. Paris, what challenges did you come up against when you were starting to bring all of this in? What were the main obstacles you had to overcome?
It's a good question. I suppose I would say not many, because actually there's in a sense there's a very natural. This is for us, it was very much a new product. There was nothing it wasn't replacing something per se. It wasn't, there was almost no reason not to use it in a strange sense. The barrier really, if anything, is you're integrating, or at least you're introducing technology. You're introducing in working or providing a service. So the main barrier or the main challenge is building this option into the clinician's mindset almost. Clinicians just being aware that this is something that they can offer their patients. That's probably one of the main things. The other thing is making sure our patients are aware that this service is out there. So the barrier sometimes is about disseminating that information to patients, to let them know that there is something out there that they can access and can use. So those are probably the barriers, surprisingly enough. But other than that, because it wasn't replacing anything, or essentially not even dramatically modifying any particular pathway, it was just about providing an additional offer to a patient, then actually it becomes less difficult. The challenges in the future, I think, from us now, about how do we integrate this more into what we do, and how do we link this in with other initiatives that we have. So we've introduced psychological therapy trainees into some of the work we do, and others. So it's actually, how do you start to link these things together? So I think there's a long evolution of this sort of offer, but from the very basic starting point of offering a new service to patients who can access that freely and openly, there's no significant barrier there.
Well, that's good to hear. And also, Faris, how did you let people know? I mean, people, certainly if we're talking about the GP surgery, people come make fewer visits now. So either in the old days, sort of my early days of waiting in a GP surgery, you'd spend hours reading the posters or the notes. But I mean, it's all different now. How did you inform your patients that this service is available now and this is how you can access it? What worked well for you?
Okay, so frequent reminders to clinicians, first of all, that there is an offer here, and how they could present that to patients. That was obviously useful, because that means that clinicians are aware that there's a service when it's appropriate to offer that to patients. So that's very easy. Social media, especially for those, social media is very good. So we could sort of announce the service and promote the service via our social media channels, via our surgeries, and via our primary care network. So patients became aware. That could then filter down into surgery newsletters to patients. So those are probably the main ones. Business cards. So we got some custom-made business cards. I've just knocked my camera there, but I've got one of them sat in front of me on the table. A business card just offering what the service is, a QR code on the back, so they can just scan the QR code and off. So things like that. We also got in touch with local magazines and newspapers, and many of them were really interested and even ran adverts. I say adverts, but articles for our PCN about mental health and well-being, and included an image with the QR code and details on the online platform, and that went down really well, and people were really enthusiastic about receiving that sort of information. So we've kind of gone, tapped into those avenues, really.
Wow. Judith, were there similar sorts of avenues for you when you were trying to let people know about what was on offer?
Yes, and we came up with some really good ideas, like printing it on prescriptions, repeat prescription. And in Bucks, which is quite near where I live, they used to put adverts on buses. And I would be driving along and see these adverts. But I think it is the trickle effect, trying to sort of get it out there. But one of the other things is getting word of mouth on success. So we would also publish what people said about it onto various websites and social media. And we had a Facebook page so that we could actually put what other people said about it, not just us, but also letting the GPs know and the referrers how many people were perhaps recovering, and could actually see that it was making a difference to people's lives. And I think you're absolutely right, Faris. It's the world is just sort of opening up, because how we can actually help people with physical health problems and also well-being. And when I think it was Keris was asking, who could treat? I think there's also this concept that we've got physical health practitioners who could also help patients with some of their mood whilst they're obviously recovering from a physical illness. And sort of the example of long COVID, we know, and there is a potential that actually offering it to people with low-grade chronic health problems really does benefit their mental health. And then obviously they recover more and they become more active, and that vicious cycle, the holistic well-being, actually, is exciting. Particularly, I'm excited because I'm a physical and a mental health practitioner. So looking at how we think about people as whole people to help them get better is really important.
It's so important. I can see you kind of smiling, Doug. I mean, this must be music to your ears. And I guess is what drives you. When you hear and get feedback from people like Faris and Judith, and you hear from real life people whose lives you're touching and affecting, that must be very satisfying for you, I would imagine.
Yeah, it's always amazing. I remember doing a talk once at a local school, like sixth form college, and someone walked past me afterwards and went, "I'm a SilverClouder," and you just think there's a whole group of people out there that are like in this kind of. We try and make it very see. That's one of the key things about the platform, is we try and make it feel like a social kind of a safe, we call it safe social, so you can see other people's experiences, all anonymous in there and all signed off and all agreed with, and it makes it feel like it's a much more of a community-based approach, but in a much safer way. Also the way we do the personal stories allows the tales that are told in therapy the whole time to be seen within the context of going through, and they're not all successful, there's struggles and things, so it feels a very real experience for people, and you get that feedback the whole time. And I'll probably be a bit lost on people, but my favorite bit of feedback was from an art therapist who I thought was going to tell me to sling it, but then she's like, it's the most amazing thing I've ever done. And that, from an art therapist to say that a CBT based approach is really amazing, was quite something. And I have that in my head the whole time when I'm getting negative feedback on the program. But so it's great. So it's a great experience for people.
And it's only going to get better, Doug. This morning, I was thinking about the event this afternoon when I was recording a podcast with an expert in Dubai on the metaverse. Oh. And we talked about the NHS, because I host these NHE conferences a lot. And we talked about digital transformation within the NHS. And gosh, he filled my head. What I know about the metaverse, I could write on a postage stamp and have room for more. But when you start to hear somebody knowledgeable like that explain it in layman's terms, the metaverse has all sorts of exciting opportunities for you, I think, for longer term when it's more of a thing that we're all into. You know, I remember learning to write an email when I was 30 and wondering why we needed it when we've got the Royal Mail. So I'm sure in the next few years, virtual reality will come into its own, and perhaps in your world we'll be visiting somebody in that metaverse to experience some of SilverCloud's offerings. I would have thought. It's exciting times, isn't it?
Yeah, it is indeed. But the one thing to say with all of those things is that what we're trying all the time is to have human connections and keep in like one of the biggest things is about getting people out and actively doing things. For depression, one of the best some of the best outcomes are through getting more physical and doing physical activities. So yes, if we can have the metaphor verse following us around so we don't all stop moving and speaking to anyone, that would be great.
Let's just take a few more questions if we can, and they're not for anybody specific. So if you don't feel you're the right person to answer this particular question, because I'm seeing them fresh too, then let's hope another of our guests can chip in. Kate would like to know, which programs do you think can be offered as self-sign-up without the involvement of a supporter? Our offer is currently limited to space from stress, COVID, space for resilience, sleep, and the supporting an anxious child / teen. I don't know. Do you want to start, Doug, on that?
Yeah. So this is one of the things that the Faris's team has challenged us with. Is that when we're giving this to people, we don't want people to be overwhelmed. We want people to start in a much more in a self-management way, so that people feel like more grounded and being able to look after themselves, because they might have to wait a long time for things. So we've started to build a program with Berkshire as the guide for this, a program about self-management, and we're about to start trialing that with Faris's team and with other teams, some other PCNs, just to see if being able to do that program first and then move on to the more specific programs after that will be a better way of people engaging. So was it Katie? I couldn't. The question's gone now. Yeah. So if she wants to contact the person who's running the contract, and if they're interested in piloting it, we'd be more than happy to talk to them.
Oh, that's kind. Quick question. Perhaps you could answer this, Judith. It comes from Paul. Is there a list of or directory of digital mental health pathways already in operation?
Well, the best place probably to go might be to look at their NHS Futures site, where there are examples there. And if you were interested in working with SilverCloud, then I know they have some pathway examples. I'm not sure what else. I'm sure my other colleagues have probably got answers, additional answers to that.
Any other thoughts, Faris, there?
No, actually, I do know that NHS England providers, I think on their website, NHS Digital. So there are sources out there to look at those who have been approved and certain apps that have had NHS approval.
Fantastic. Faris, Nicola's asking, what ideas do the panel have to ensure equity of access where there are areas of digital deprivation? And it is a subject, Nicola, that comes up in all of these events that we do. It's so important, isn't it, Faris, that we don't leave anybody out of this. And it's not necessarily elderly. It might be people who haven't got the iPad or the phones to access this information. How have you managed that where you are?
Gosh, I saw that question pop up and I thought, if I get this one, this is
I'm sorry, it's a tough one.
But don't worry, because it's a really good question. It's a really good question. And actually, it makes you reflect actually about inequalities, because sometimes we think about inequalities on purely a financial level or various ways, but actually even working people suffer an inequality, because if you're a working person, being able to take time out of work for psychological therapy face-to-face is really difficult thing to be able to do, which in itself is a barrier to access, which is where the idea that having digital solutions that you can access in your own time actually opens the door to intervention and support of those people who are working. Then you open the door to digital deprivation, and that's a really tricky one, and that's something that probably needs its own thoughts and its own considerations, and is actually probably very maybe geographically based, almost identifying what the reasons for your digital deprivation are. Patients. So, for example, within our PCN, we have a rural and semi-rural, often elderly which possesses its own difficulties when it comes to digital. We have had some thoughts on what we could do to address this. Not saying that we've addressed it yet, but we've had thoughts about actually utilizing a public space as an internet cafe type space where people can just access and use computers in their own free time. So sort of going back to that old-fashioned idea of internet cafes, but in more public spaces, obviously libraries you might think of, but we're actually working, we're actually spending a lot of time within a community hub that we that we deliver services from and give talks from. Well, actually there's the opportunity there to have computers that anyone can pop in and access, and actually that hub is most frequently frequented by our more elderly patients, so actually that works quite well. And we've had thoughts about actually, do we run a session where we bring in people who have old computer equipment and a repair, and then they can actually give out equipment even for free of charge that's been recycled, upcycled and passed along. So there are some solutions there that probably need to be explored more on a geographical level. But I would say that this solution is more about thinking about providing an additional item on the menu for those people who are almost not able to access our conventional services.
I wish I lived in Warwickshire. You've put so much thought in, and I'm suspecting Judith put equal amount of thought in when she was at Berkshire. Judith, I bet you had some ways of making sure that people didn't feel excluded.
Well, we were able to put in for a bid for some tablets so that we could have a loan system. It never, which was very, very helpful, and also for patients on mental health wards so that they could actually have their own individual access. But interestingly, I'm involved in a community project near where I live, where we have set up a community cafe, and we've got some tech buddies. You've just given me an inspiration, though, that we need to be making sure through their GP practice they could perhaps actually also access something like a SilverCloud platform, because we're doing it to connect people. But wouldn't it be great to help people connect to mental health and well-being? So I think these community ideas and working how to overcome it. But also I am aware of silver surfers. I'm getting a little bit older myself, but also I have a 99-year-old mother who, when she was 96, I did try out the SilverCloud program on her as a demo. Oh, this is interesting, she said. And she uses an iPad. So I always think as long as you've got support and technical enablement, you can achieve quite a lot, and making sure that you've got somebody perhaps within a service who can help people with technical instructions to begin with. But it is actually much easier than you think. You know, so many of us now do use so much technology. And I do know one patient who used to just put on her phone right at the beginning while she was still in bed, do her instructions, go over, rehearse her day using her SilverCloud app, and get up and go and be active. So I think, you know, it is very good that you can use it at various times in your day. And we all know, lots of us now sitting on our sofas looking at the internet when we should be talking to people. Well, obviously you can quietly be using it, looking at SilverCloud.
I think, Doug, you know, it's true, isn't it? Everything's going digital now. You know, so many things are so much easier to do digitally, you know, whether you're just buying train tickets or whatever you're doing. So making sure that people aren't excluded is important, not just for this, but just to make sure that there's still people feel included, whatever they're doing. And I think the idea of combining this with a community cafe or somewhere where you've got tech buddies is brilliant, because what we have to make sure we don't lose in all of these amazing innovations is the power of company and being together. These are great, but we also need social interaction, don't we?
Yeah, and we encourage that within the program. So the thing to remember is the program was developed to help release more resources for services to be able to provide better care to people who need a lot more care than necessarily needed on the program. So if you don't need any more support, the program will help you and off you go. So that releases support for people. But the ideas about community cafes would be great. We'd love to support those things. We're always looking for opportunities to expand the inclusiveness of the program. So we do work very hard on that. We're working with a company at the moment to bring in sign language into the program. So that's quite a good innovation. So there's loads of real opportunities to do this. It does depend on the service, though. We've had lots of requests for different languages, but when we sit down with the clinicians, they're seeing people through interpreters already, so it makes the development of the program quite complicated. But we will always be looking to increase the accessibility.
Well, Doug, Shanaz says patients with learning disabilities, autism, anything available to help the system, work perhaps more smoothly for people, with disabilities or things like autism.
So specifically around autism and ADHD and neurodiversity, that's a big thing currently. We're building a program at the moment to help people with that group. So look out for that towards the end of the year. So that's quite an interesting program, because that's less about therapy, is more about helping people develop the strategies and the understanding of their condition to enable them to really engage in life. So it's quite an exciting development for us.
Lots of things are developing. I'm whipping through these questions with you, Doug. It feels like you're on Mastermind, and we'll get to Paris again in a minute. But your starter for 10 from Molly, anything coming available for children and teenagers, specifically aimed at that cohort?
Yeah, sorry about that. Yes, so we have built a program for children and young people that can be delivered within CAMS for depression, anxiety, and for combination, but also a parent program as well to support children with those presentations, because what we find is that there's an awful lot of anxiety and worry for parents, and having a program that they can use while supporting the young people within the services, it was really asked for when we developed it. So if they want to speak to our company, we'll be able to show them around the program. I can come and do a demo if they want to see it. So that'd be lovely.
And Amanda, anything available or in development for people with personality disorder, complex emotional needs? And that is the last of your starter for 10. And then you can have a cup of tea while I talk to
yeah, that'll be lovely. So around personality disorder, there's no program developed yet, but we have worked with some services to provide treatment pathways to people with personality disorders, and they've used the program because often with those kind of treatment pathways, they're quite complex. So often for the low-level depression, anxiety that people experience, they don't often get that help. So the program's been able to work alongside people. We have loads of feedback for that. The other thing that we're doing at the moment is we're beginning to develop a strong emotions program. We haven't quite narrowed down the name yet, and I'm not allowed to name programs because I'm terrible at it, but something that helps people who've got strong emotions and are beginning to cope with really difficult things that they're going through. And we are beginning to build out a trauma program as well, which will be used alongside other programs. So there's quite a lot going on. We are developing quite a lot.
There's such a lot going on. I mean, Paris, it's interesting, I'm sure, for you to hear some of the things that are in development. But speaking more generally, what benefits do you see of digital over some of the traditional services that we're used to in the mental health sphere?
I suppose the benefits are really clear. Immediate access. So there's no waiting times. Patients are coming at a time of need. They need something to help. You can give them something straight away. So it's that ability to access a treatment pathway sooner. It's the ability to have increased and wider uptake. So you'll, like we said before, you'll be able to potentially have uptake from users or those where time is a barrier to them can just log on at night time and do it when they want or in the weekend. So I think that's another one. I think it's the 24/7 access, which comes in there too, which you can't get with conventional interventions. And I think there's something else in my head. It's also about self-help. It's also about being able to access something without the need to get into the NHS services, if you like. It's that ability to access some help a little bit sooner. And I think in the coming years, I'm sure there'll be a real move to not just mental health, but health and well-being. We're already seeing it. So how do we promote mental well-being? It's something that we maybe don't spend much time thinking about, but if we can get in any human alive that's not going to benefit from some form of psychological therapy or intervention, even when you feel like you're doing well, there's resilience that you can build from understanding your own mind better, understanding your own thoughts better. So it's about helping build maybe more resilience within our populations by essentially giving them access to tools that a little bit sooner. So I think those are the main areas I think where digital is really good.
I do think, Paris, that as a society, I feel that we're a lot more aware of well-being and taking care of ourselves a bit more post-pandemic. And I am the eternal optimist, and I do like to try and think that when we go through something terrible as a nation and as a world, that something good can come out of it. But I know personally just the benefits from that. I used to get up during the pandemic about 5:30, 6 in the morning, head to Richmond Park with my little boy before the dog walkers, before the cyclists were out there, walk, get into nature. And that's something that I just didn't have time for living in central London before the pandemic. But it's made me much more aware of my own wellness and finding time just for a little bit of self-care. And I think that does an awful lot for our mental health, doesn't it?
I totally agree. Maybe you should come to Warwickshire. There's plenty of parks to walk around. I'm tempted. But you're absolutely right. And the difficult thing is we all know it, isn't it? We all know these things, but actually when your mental health does start to decline, you start to forget those core elements really that help us get better. And I think that's where access becomes really important, because for lots of people they're not aware of where to access those help, where to access services and where to access self-help, particularly for their mental health and well-being. So I think it's about having something that people can just go into quickly. It's that quick reminder, I suppose, like you said, Judith, it's about having someone in your pocket, really. It's about having that quick access to help and support, and I think that's where it becomes really, really important, and accessibility becomes a big issue. And I suppose online accessibility, the two go hand in hand to a large extent.
Judith, what can be done, do you think, to improve integration between mental health services and stages of care?
I think it's about considering mental health at every stage, and we haven't always been very good at that, and the connections between. And I think, the prevention, early detection, encouraging people on their own journey of self-learning, self-responsibility, empowerment. And I think something like the mental health platform we're talking about brings agility. It brings agility for staff. It brings agility for people to look after themselves. And it is very accessible. And I think those steps help to integrate the pathway, and starting with perhaps self-management, looking at perhaps some screening tools so that we can actually help people as soon as possible, wherever digital can be used, not wanting to obviously replace our GPs, replace our mental health experts, but trying to help people really early in a way that they actually find really useful. And I think that's what we mustn't lose sight of, is that the people find it really useful. And it used to be, if you were in mental health, that actually the clinicians had textbooks, set homework. Well, you can imagine how heavy that feels for people who've got a mental health problem, is that actually you're setting homework. So I think that whole idea of coming into finding solutions, tools, but what's great about the platform, and this is where it can help anybody with any health need, is that actually it's visible. It's very much, how many times have people accessed it? What have they found helpful? They can leave messages. They can leave messages for themselves. They can kind of keep their own self-help diary. So I think it is just very empowering. So I would challenge us to think really to transform our services as much as we can across every part of the pathway.
One more quick question from Ray, Doug, to you, and then I'm going to ask you, Doug, the $6 million question, so brace yourself. Ray says, are there any interesting sources, papers or articles on the NHS's ambitions to expand these kinds of services? Any that you've seen, Doug, or if not?
Yeah, there's quite a bit on there. Yes, it'd be tricky to say specifically. We have quite a lot of research done within what we do, and the NHS has in the global exemplars examples of where all this is there as well. And there is an awful lot of literature out there. If you Google ICBT, you will get an awful lot back from it. I can send some stuff too, Ray, if you would like me to send
that would be great. Yeah, that would be fantastic. I'm sure we'll collect, Ray, if you put your email address, or in fact perhaps anybody who wants a bit more information can leave their email address, and the team will sort that. So the $6 million question, Doug, that we're going to end on, your vision of a digitally enabled future for mental health care? When you lie awake at night and you're imagining all in your head, what's your vision?
So we can't so digital won't replace everything, but it will certainly help people get access really quickly. So my whole vision is that the way things work now is you go to a website, you sign up, and then you're offered a digital alternative at the right time. Going back to what we said earlier, if you get the right kind of information at the right time in the right way, it can transform your life rather than waiting a long time to speak to someone and then bringing all of that waiting and that wanting someone to have the skills to change it. It's much easier if you go very quickly and understand it very quickly, and off you go into the world. So just being able to access it from any website in the NHS, being able to access a digital and it to be validated and be understandable and to be personalized as well would be amazing.
Fantastic. That's a very positive note to end us on. What an interesting conversation. Thank you so much to everybody who's taken time to join this panel discussion. My thanks to Faris, Doug and Judith, and to everyone who sent in their questions and took part. And thanks very much to our event partner, Amwell, because of course, without whom these events wouldn't be able to take place. So from me and everyone at NHE 365, thank you for listening. I look forward to seeing you at our next event. I hope you've enjoyed this one. Bye for now.